an insight into sexually transmitted diseases, STDs.
Okay, let's start. So, to understand a sexually transmitted disease, we have classified this topic into different domains. The first one is the incidence of the disease. Number two is the classification of these diseases. Number three is the possible treatment. And number four is the prevention, how we can prevent the STDs to happening or to break this chain. Okay, sexually transmitted diseases, STDs, also known as sexually transmitted infections, are spread infections spread primarily through sexual contact. These are sort of infectious diseases. Either they can cause by bacteria or viruses or other different organisms, and they are spread mainly by the sexual contact. Understanding them is the key to the maintaining both personal and public health. So here is the diagram. STDs. It either can be due to mycoplasma, HPV virus, HIV, chlamydia, gonorrhea, syphilis. These are different type of bacteria. We will go them and see them one by one in the next slide. Okay, why are we studying STDs, sexually transmitted diseases? STDs can cause numerous health problems, including pain, infertility, and increased risk of certain cancers. As you all probably already aware of this, that sexually transmitted diseases are a heavy burden to the health sector these days. As the number of cases are rising, the resistance to the antibiotic is rising, and this is a huge disaster if this is going to increase in this way, and if we fail to control this. They also have significant social impacts, such as perpetuating cycles of poverty and stigma. Uh, some of the STDs or sexually transmitted diseases run in the families of certain third world countries, in which HIV, for example, is transmitted from the mother to the children, and they spend their whole life in the misery. And when they marry or they get a partner, this disease further gets spread unscreened. So it is very important to get it screened and get it treated. Most of them are, treatable. Some of them have already can be prevented by the vaccines or immunization programs. So to effectively control the flow of STDs that run in families such as HIV, some diseases are just, can be transferred from one person to another person via sexual contact, but some can run through mother to the fetus during the pregnancy or the during the birth. So if this cycle continues, moving next, it is we will talk about the incidence of this disease. We will first we will talk about its incidence worldwide. Then we will talk about the density in the US or UK. So according to the World Health Organization, over 1 million sexually transmitted infections are recorded every day worldwide. So WHO says on average, 1 million persons get infection by sexual contact every day. The most common are chlamydia, gonorrhea, syphilis, and trichomoniasis. These three, four are the most common ones. In the US and UK, if we speak about the STDs, according to the Centers for the Disease Control and the Prevention (CDC), as one of the most recent data is one of the presentation dates, million of new cases of STDs are reported each year in the US, with around half of them among the young people aged between 15 to 24. Most uh, people who are prone to these STDs are 15 to 24. This is probably due to the lack of awareness about the screening program, about the spread of this disease, or awareness in overall to how to have a safe sex or have a good sexual relationship with partners. So if we talk about the most common infection, it is chlamydia. It is most commonly reported STD with a nearly 1.8 million cases, followed by gonorrhea with more than 6 lakh cases and syphilis with approximately 1,15,000 cases. Rates of all three diseases have been increasing over the years. If we speak about these three most common infections, chlamydia, gonorrhea, and syphilis, these are the number that is recorded. Also, there is all many cases which go unscreened, or people are asymptomatic. They doesn't show any symptoms. They doesn't go through the screening process. So this doesn't come in the record. A large population goes unscreened and unrecorded. So the number is much more higher than this one. According to the Public Health England, as one of the most recent data, there is estimated 4,20,000 diagnoses of sexually transmitted infections made in England each year. Chlamydia is also very common infection here. It is the number one, with nearly 2 lakh cases, followed by genital warts caused by human papilloma virus. It is also another infection, genital wart. Its name and the virus that causes it is called human papilloma virus (HPV), with over 60,000 cases, gonorrhea with approximately 55,000 cases, and early syphilis with around 7,500 cases. So we will go these diseases one by one in the pretty good detail. Right now, we are talking about the incidence of these diseases. Let's see here the UK versus US. Different chlamydia is the number one in the UK among STDs. In the US, herpes is the most common, then followed by genital warts. Then in the US, again, HPV is more common. Gonorrhea and syphilis, they are almost the same proportion in the both sides. HIV is more common in the UK than the US, relatively other than other STDs. So moving to the next, uh, how we can screen the STDs, or how we can diagnose if a person is having a sexually transmitted disease or a regular routine infection. So there are different screening methods for men and women. Uh, Different kind of testing kits are available. Either they can be done in the hospital, or there are kits available in the market that a person can personally test himself. So HPV is a virus. Mostly, it causes cervical cancer and other sort of genital warts in the woman, and it can be diagnosed by taking a sample from cervical swab. Syphilis can be diagnosed by a blood test. Gonorrhea and chlamydia are the bacteria that can be diagnosed either by the swab from the wound or urine test. HIV, it can be diagnosed by either oral swab and the blood test. Herpes and other type of bacterial infection, blood test or fluid sample from the wound or the lesion that caused by herpes bacteria can diagnose the test. Again, the next one is hepatitis. It is caused by different type of viruses, so we can diagnose this by blood test. Next is trichomoniasis and bacterial vaginosis. It can also be confirmed and diagnosed and tested by vaginal swab and the urine test. These are the different sampling methods. We can take samples and send to the labs for the confirmation. So the treatment can be planned accordingly. So the next topic, the subtopic is classification of STDs. Sexually transmitted diseases are very diverse, caused by different type of microorganisms. So to approach each kind of STD or each kind of infection, we have to first we have to find out which uh, organism is causing it. Either it is bacteria, either it is virus, either it is a sort of parasite. So we will go one by one through these types. First one is bacterial STDs. Number two is viral STDs. Number three is parasitic STDs. These three are in the descending order. Bacterial STDs are very common, followed by viral STDs. In viral STDs, HIV is the most common, and then it is followed by the parasitic STDs. Bacterial STDs are mostly caused by bacteria, very single cell microorganism. If you already probably maybe aware of that, bacterial STDs often can be cured with antibiotics if detected early, or if they are uncomplicated. They can be treated very easily, where either it can be oral through antibiotics, either by IV antibiotics. So a wide range of antibiotics is available to treat the bacterial STDs. Next one is viral STDs. These diseases are caused by viruses, microscopic parasites that require host cells to reproduce. Viruses are much more smaller than the bacteria or bacterial cells. Bacteria are independent cells, while viruses are just small tiny particles which require another cell to reproduce and replicate their number. So viruses just go in the body and infect a cell, go inside and uses its contents to reproduce and makes more many viruses like itself, and it replicates and multiplies, and eventually it destroys other cells of the body. While these cannot typically be cured, the symptoms can be managed and progression of the disease can be slowed or halted. Unlike the most bacterial STDs, viral STDs are treated differently. Most of them resolve on their own. Some people are already immune to them, either by vaccination programs, or either they have a mild disease, or if they are not getting cured, list of antiviral drugs are available. Uh, they are used to treat viral STDs. Next one is parasitic STDs. These infections are caused by parasites, organisms that live on or inside the organism, the host. Bacteria are very smaller, single celled organisms. Viruses are also very tiny. Parasitic STDs are very, kind of big, sort of gross. Their parasites can be seen with the naked eye. They are more like live, uh, that it mostly causes mostly resides and causes itching in the hair or scalp. So these are parasites. They either live on the surface of the organism or they just go secondary and they cause the disease. They can often be treated and cured with specific medications. There are a list of shampoos available, lotions available to cure them, or antiseptic. The next few slides will provide a deeper look into each of these categories. We will go one by one into the bacterial STDs, viral STDs, and parasitic STDs, which are most commonly, encountered in the health sector. Among the bacterial STDs, we have very three common diseases: gonorrhea, syphilis, and chlamydia. I was talking about them. Uh, these three are very common. So first one is gonorrhea, caused by bacterium Neisseria gonorrhoeae. Gonorrhea can infect both men and women. Infection can occur in throat, rectum, and genitals. Gonorrhea is, caused by a little bacteria named Neisseria gonorrhoeae. It can infect both sexes. Infection is usually starts from the genital area, and then it goes to the rectum. Then eventually it can be disseminated through the blood or by the contact, and it eventually can go to the throat and cause infection there. Next one is syphilis. It is caused by bacteria Treponema pallidum. It is another type of bacteria, and it is characterized with different stages with varied symptoms. There are different stages of this syphilis: primary, secondary, tertiary. This disease can be, very mild to very severe form. So it depends at which state we catch the disease. So if we catch the disease at very early stages, it is cured very easily. If the disease is progressed and advanced, it can cause damage to the nervous system and cause a number of complications, and cannot be treated easily as compared to the early stages. The next one is chlamydia. It is a third most common bacterial sexually transmitted disease. This is a common STD caused by bacterium chlamydia trachomatis. This is another type of bacteria. We are talking here about the bacterial sexually transmitted diseases. These three different bacteria are causing three different diseases here. So it can infect men and women and cause serious permanent damage to a woman's reproductive system. It is mostly or least likely asymptomatic in the man, and in the woman it causes severe damage to the reproductive system or genitourinary tract. So each of these bacterial STDs can be effectively treated with antibiotics. If we catch the disease early, we can give oral antibiotics or we put the patient on the prophylactic treatment so that infection resolves as early as much possible without any complication. So it is important to get tested because many people with these infections won't have obvious symptoms. Regular testing ensures early detection and the treatment. Some of people, are asymptomatic and the bacteria or other organisms stay latent in the body. If the person gets immunocompromised in any age of his life or late age, or if he gets old or gets immunocompromised, either he gets HIV infection. So these bacteria gets active again and uh, cause severe symptoms. So it is very important to get screened regularly, either if even if you have are not experiencing any sort of symptoms, but make sure you get screened regularly, either once a year or twice a year. So the number one is gonorrhea. It is also known as the clap. It is bacterial STD caused by the bacterium Neisseria gonorrhoeae. We are going into the details step by step. First of all, we in the previous slide we divided all the STDs into bacterial STD, into viral STDs, and to parasitic STDs. Now we are going into the details of the bacterial STDs. First one, disease uh, that is a category that is categorized under the group of bacterial STDs is gonorrhea. Gonorrhea, also known as CLAP, as I told, it caused by Neisseria gonorrhoeae bacteria. Both men and women can be infected. It can infect the genitals, rectum, and the throat. Infection, as I already told, the initial infection starts at the genitals, and the person is mostly not aware of that as it is mostly painless. As the disease progresses, the lesions or the wounds get painful because it gets more and more infected, and the infection spreads to the throat and the throat and the rectum. Here is the picture of the male genital system. As you can see, there is a pus or sort of discharge coming out. It is gonorrhea. This pus is coming out due to the infection of the lining of the urethra or the urinary tract of the male who might got into contact with the person who already had STD, and that person transmitted STD to this person, and this person got infected, and now this person is uh, suffering from the symptoms of this infection. I must say a severe infection, so the pus is coming out. Most infected men and some infected women have symptoms like burning sensation while urinating or unusual discharge like this. If left untreated, it can cause serious complications like infertility because it can damage the lining of the genital urinary tract in the men as well as women. So there is high chance if we left this disease untreated, it can cause problems like infertility or subfertility, I would say. So this little guys, these are the Neisseria gonorrhoeae bacteria here. These little ones, these are. You don't need to go for these details. These exist in the pair form, diplococci, and these bacteria appear like this under the microscope. These are bacteria known as Neisseria gonorrhoeae. Moving to the next disease, this is syphilis. Syphilis is another bacterial STD that it can cause long-term complications if not treated correctly. Symptoms in adults are divided into stages: primary, secondary, latent, and late syphilis. Primary is a very basic infection and can be resolved very easily. Secondary is the a little progressed disease. Latent is in which bacteria get entered into the body of the person but do not show any symptoms and stay latent until the person gets immunocompromised or the person gets another infection like HIV that ruins its immune system. Then this latent syphilis becomes very obvious and causes infection. The late syphilis is a very much more progressed disease that causes a variety of symptoms, including skin disruption, multiple painful pustules like all over the body, or they start coming out, and the throat infection, and nervous system damage, the spine damage. This is uh, it can get as worse uh, as much possible if we do not treat the syphilis in the right time. It starts as a painless sore and can progress to non-itchy body rash. Late stage syphilis can result in damage to the brain, nerves, eyes, and heart. So it is very important to get it cleaned, get it treated as early as possible to avoid the damage, like the brain damage or the nerve damage, or it before it can damage eyes or heart. So this is the primary disease that is started from the genitalia. Probably this is you can see here is the ulcer, a little wound here. It starts as a non tender or painless sore. Then this one is also a primary ulcer. This one is secondary. As you can see, this disease is spread to the multiple areas. It is the palm of the hand is already affected. The sole and the foot is already involved. The chest is already involved. This is the secondary disease. In the tertiary disease, this disease does not stay just skin deep. It goes to the multiple organs and cause a profuse damage. So this guy, a little snake looking like bacteria, is called Treponema pallidum. It is spiral-looking bacteria. If we see in the microscope, this causes syphilis. This this little guy causes damage to the skin and mucous membranes of external genitalia, mouth, and other different organs if we left it, if we leave it, sorry, if we leave it untreated, or if we let it do its work. It can do extensive damage to the multiple organs, and syphilis is one of the worst STDs. Next one is chlamydia. Chlamydia is a very common STD that can infect both men and women. It can cause serious permanent damage to a woman's reproductive system. This can make it difficult or impossible her to get pregnant later on. This kind of disease, like chlamydia, or I have talked in the previous slide, this kind of disease, damages the epithelial or the internal lining of the, uterus or the urethra or the genital urinary tract. So it almost gets impossible to the fetus to attach whenever the person is trying to conceive. So this whole lining is already destroyed by the STDs if a woman doesn't get it treated. Chlamydia can also cause potentially fatal ectopic pregnancy that occurs outside the womb. If the uterus is already damaged, its lining is already damaged, the fetus doesn't get a proper safe space to attach. So it can, move randomly to any place, or it can slip outside the uterus to the fallopian tube and can attach to any other site and cause fetal ectopic pregnancy. Ectopic pregnancy means pregnancy at any site other than the uterus where it should be. So symptoms may include discharge and a burning sensation when urinating. This is a very typical presentation of the chlamydia. This little guy, these rounded balls are the chlamydia, and this is a picture of bacteria under microscope. These are the chlamydia bacteria. So this is the variety of symptoms can cause in the women and the men. In women, initially initially or usually they doesn't have any symptoms at first. Then it progresses to painful urination and vaginal discharge, lower abdominal pain caused by pelvic inflammatory disease. As the disease progresses to upwards, it can cause, inflammation in the pelvis. So this is a complete term, pelvic inflammatory disease. It is more infection in the pelvic area, this area right here. The infection progresses from here and it goes to this area and this area and this whole area when get under inflammation. It is called pelvic inflammatory disease because this one is pelvic area. uh, Women can also suffer from the menstrual problem because they may suffer or a premature menstruation or irregular period, may have urinary problems like burning sensation, or may see pus coming out. They may have infertility if the disease persists for too long and goes untreated, and when it causes pain or difficulty with the urination. Drops of pus from the penis if the infection is untreated. This tract is infected and we do not treat it. The bacteria causes inflammation here, and this turns into pus. If the person urinates, it causes burning sensation, and then the pus goes out after each time the person urinates. Painful swelling of the testicle, as you can see, these structures of external genitalia in a male all closely related. So this infection can spread to the testes as well. So it can also cause inflammation or swelling in the testes. If the disease progresses too much, then it can also cause swelling in the knees, ankles, or the wrist. It means this disease, if this disease progresses by the blood, it can go to multiple joints in the men and cause painful swellings, rashes, or sores all over the body. And it can also cause infertility in the men as well, because as you can see, these line the tubes go from here and it comes through here. So if the infection of the lining destroys the internal side of these, or if they cause the inflammation of the testis, they can all cause infertility or subfertility in men as well if they let it untreated, or they do not get proper treatment or get antibiotics. So the next section, this was all about the most common three bacterial sexually transmitted diseases. The next topic is viral sexually transmitted diseases, viral STDs. Viral STDs are diseases resulting from the infection by virus. Common viral STDs include herpes simplex virus (HSV), human papilloma virus (HPV), HIV/AIDS, hepatitis B virus. So uh, the first virus is herpes simplex virus. It is also of subtypes HSV1 and HSV2. Both causes different type of infections, causes oral and genital herpes. While there is no cure, antiviral medications can prevent or shorten the outbreak. Some of the viral diseases are, untreatable. We can only give the supportive treatment. We can only ask the patient or advise the patient to stay hydrated, to take fresh juices and vegetables to to make the body quickly fight the infection. Antiviral medications can only prevent or they shorten the period of infection. They are supportive, but once the infection starts in the body, it requires a adequate time to resolve. So we can give supportive antiviral medications as well as other dietary supplements to shorten the progression of the disease. Next one is human papilloma virus (HPV). It's called genital warts. Warts are like small outgrowths on the genital area and linked with some type of cancer. HPV is the number one cause in the cervical cancer in the woman. So this is the main culprit in the cervical cancer. It stays latent for years in the woman and doesn't necessarily cause genital warts, and it appears, it causes cervical cancer very slowly. Vaccines are available to prevent the most dangerous type of HPV. There is a whole list of types of HPV. Each of them has own severity if they cause disease. Next one is HIV/AIDS, a human immunodeficiency virus. HIV can lead to acquired immunodeficiency syndrome (AIDS). HIV is the name of the virus. AIDS is the syndrome or the disease that is caused by it. So antiretroviral therapy (ART) can manage the condition. Now HIV is treatable. Uh, this HIV or AIDS used to be a stigma in back like 1 or 2 decades. Still it is, and still a large number of people are suffering from it as they do not use adequate protection, or they do not get regular screening. Even if they get screened and they get diagnosed, they do not get proper treatment for it, and they spread to their partner or their offspring. So this disease is one of the major challenges in the study of the STDs. Different antiviral therapies are being you know invented to cope up with virus, because this virus is not the not only have one type. It gets mutated and gets changed into other type of viruses, so it doesn't get caught very easily. So HIV is one of the major challenges or health sector is facing. A heavy burden of cases is caused by HIV. HIV decreases the immunity of a person, then it leads a person susceptible to the number of infections, like bacteria or different type of fungus find it opportunistic to do infections, and the person gets worse day by day. So it is very important to get screened regularly, to take antiviral therapy, ART, antiretroviral therapy, to cope up with the HIV, to keep it below detectable range, or to uh, keep it at a range where it is not transferable to the partners or the uh, babies during the pregnancy. So HIV is one of the major diseases amongst the STDs that needs to be controlled. In third world countries, this is one of the bigger challenges because their ART is not available there, and it is if available, they are very expensive options. So everyone is not able to afford that therapy, and people are already facing poverty or inflation. So this kind of disease only adds to their misery, and makes this condition more worse for them. Hepatitis B is a next disease that can also be transmitted by the viruses. HB virus is the virus that causes hepatitis type B. It can cause a short-term, acute, or long-term chronic liver infection. A vaccine is also available against the hepatitis. HPV, hepatitis B is caused by HPV that can be either acute and can cause symptoms like liver enlargement or yellow skin or yellow eyes and anemia, low blood count, and the patient gets really sick very quickly, or it can cause long-term liver infection. This one is severe, and it gets progressed in the very short period of time. While the long-term disease, it is usually mild and usually goes for years if we left it untreated. A vaccine is available. If a person is not infected, then we should go for the vaccines available, because anytime if he ever gets infected or gets in contact with a person who already has STD, he would be much more safe if he already got the vaccine. So it is very important that a person gets vaccinated against the vaccines available. Number one is AIDS, HIV, that is viral STD. So HIV, short for the human immunodeficiency virus, attacks cells that help the body fight infection, making a person more susceptible to other infection and the diseases. Basically, there is a type of cells called T lymphocytes in the body that are a type of white blood cells. T cells makes up the immunity of the body. This virus attacks those cells, providing the immunity. So this virus, sort of lessens the person's immunity against infections. That person gets more susceptible to infection. Even if person is immunocompetent or if he is normal, some fungus or bacteria are unable to penetrate through their body, or if they try to get, if you try to infect the person, their immunity, destroyed them. So they are unable to produce a disease or infect a person if they are already in a healthy condition and they have a very healthy immune system. But as soon as the HIV infects the person, his immunity declines, and those bacteria or the fungi see a very perfect opportunity to infect that person. Suppose Candida is a name of the fungus that most commonly infects the person with HIV. They may present as oral thrush. Their whole oral cavity is lined by viral stuff that is thick, very sort of more like soapy content there. That's the fungus that causes infection in the oral cavity of the person that has HIV, that has I would say uncontrolled HIV, or the viral load in that person's body gets too high that his immunity declines inversely. So the virus leaves that person on the mercy of other bacteria and the fungi. So the multiple infection occurs in the person in the body of that person. So they collectively, decline the health of that person. It is spread by the contact with a certain bodily fluid of a person infected with HIV, most commonly during unprotected sex or through sharing injection drug equipment. So HIV is either transmitted to the unprotected sex or through sharing injection drug equipment. Previously, many decades ago, uh, there was, a high possibility that the syringes was uh, getting used again and again for the different persons after getting so-called sterilized, of getting to the so-called process of sterilization. They were actually contaminated and caused the spread of infection. So these days, thankfully, the syringes are each syringe is used for the single person, but the different kind of equipment that delivers drug, like there are different type of uh, sort of uh, kits that IV lines or machines that passes the filters, or there are droplet counters, different type of equipment that causes acceleration of the fluid that goes into the IV. So if the equipment is gets infected with the HIV virus, and then this can pass to the next person who is healthy already, but he got in contact with that uh, contaminated equipment. So that person gets the virus, and if he is healthy, he may recover, but in most of the cases, he gets the infection. So if left untreated, HIV can lead to disease, AIDS, acquired immunodeficiency syndrome. Acquired means that person was previously immunocompetent. He has perfectly natural immunity, and this something entered into his body and caused acquired acquired disease that wasn't previously in his body, or he previously has perfect immunity, then causes immunodeficiency. His immune cells get declined very quickly, and this whole thing causes a plethora of different symptoms and different diseases. While there is currently no effective cure for HIV, with proper medical care, the virus can be controlled. As I told previously, antiretroviral therapy (ART) is available if the person gets screened early. The infection gets caught at the early stages. The viral load can be controlled in the person, and the virus levels in his body can be controlled to the very minimum. Antiretro viral therapy (ART), a medication regimen that needs to be taken every day, allows individuals with HIV to live a long, healthy life and reduces the likelihood of the transmitting the virus to the others. ART is sort of therapy that is taken needs to be taken daily on the daily basis. It reduces the virus ability to reproduce or replicate quickly, and gives a person much uh, sort of it lends more time to the person to live a healthy life, and the likelihood of transmitting the virus to others gets very, very low. So this one is here is HIV. This one is a membrane of HIV. These are proteins. This one is a virus. Basically, this membrane is derived from the host, which are humans. So once this virus gets into the body, it replicates, it starts destroying the normal T cells of the person, lymphocytes of the person. So the person's immune system fails and causes immunodeficient condition that invites other infections. So we will move to the next type of STD. It is herpes simplex virus, HSV. It is another type of virus. It is a very common viral infection that presents as oral herpes, may called as cold sores or genital herpes. They, there are two presentation of this disease, herpes simplex. Either they can cause this kind of sores on the genital area, or they can cause this kind of sores on the oral cavity or the lips or the nearby areas. While HSV1 typically causes oral herpes and HSV type 2 causes genital herpes. So there are sub two types of this virus. One causes oral herpes, the other one causes genital herpes. Both types can cause sores in either area. Both of them causes sores. Transmission occurs through close personal contact, such as kissing or sexual contact. The virus enters the body through small cracks in the skin or the mucous membrane. So any person who is already infected can transmit this virus to the other person by the intimate contact, either by the oral or by other genital route. So most people with HSV are asymptomatic but can still spread the virus. When symptoms occur, they often appear as small blisters that break open to form painful ulcers. So these are the small blisters that form initially. Then if they burst, they get trans, they progress into a sort of ulcers that are painful. Initially, these blisters they are painless or not tender to touch. Once they burst, they transform into ulcers that are painful. So there is no cure for herpes as well, but the antiviral medications can help sores heal sooner, reduce the frequency of outbreaks, and lower the risk of transmitting the virus to others. So in this case, in the case of herpes, antiviral medications are also available that are used to treat these sores, and they help to recover from this virus very early. And these medications can also cause the virus to shed off from the person's body as it is not treated to the next person. The next one is the human papilloma virus, HPV. This is the third more common sexually transmitted disease that is caused by virus. Human papilloma virus, HPV, presents more than 150 related viruses. There is a list of subtypes of HPV virus. HPV is named for the what papilloma some types HPV can cause. So these are what skin growth brown. They are usually in the brown color. So they are also called papillomas. They are more like papillas, or if I would say, like clusters of the grapes. They give grape-like appearance, papillas. So this virus is named after these structures, human papilloma virus. Some other type of HPV can lead to cancer, most noticeably cervical cancer, but also cancers of vulva and vagina, penis, or anus. It can also cause cancer in the back of the. So the number one cause of the cervical cancer in the woman is HPV, but it can also cause other cancers of the genital tract of the woman like vulva or vagina, and causes cancer of the penis, or it can cause cancer of the anus as well, because this all area are closely related, so it can spread easily. If HPV can also cause the cancer in the back of the throat, because this disease can also be spread through the blood into the different areas of the body. HPV is the most common sexually transmitted infection transmitted through the intimate skin to skin contact. If the person is getting intimate, either are they are having a intercourse, or even if they not, if they got into a skin to skin contact and one of them had this virus, so he or she can transmit to their partner. HPV can be prevented by the vaccination and safe sexual practices such as that can reduce the likelihood of infection. So there is vaccines available for the HPV, because HPV is directed into the cervical cancer. So a number of developments are done in the vaccination centers for prevention of cervical cancer. So it can be prevented by the vaccination and safe sexual practices that can reduce the likelihood of infection. So this one thing is very understood here. If the person is healthy, he should get vaccination against the you know uh, the diseases, most common disease in the society, like this kind of sexual transmitted disease or other diseases. So it is very, very important for a person or family to get their children vaccinated as well from the very age of birth to the neonatal age, to the very early childhood age, to the early teenage age. So a whole, schedule of vaccines are available, like diphtheria, tetanus, measles, polio, etc., etc. So it is very important to, immunize against the deadly disease. So it is very better to be vaccinated against the disease than to treat them, because prevention is much more easier than the treatment. So safe sexual practices and the vaccination is the only possible option to avoid this kind of inconvenience, very major one. So these are the genital warts found on the shaft of the penis. This long area is called the shaft. So the most warts are, located here on the shaft of the penis. While if we talk about the warts in the female, it can be either on the vagina, inside the vaginal canal, vulva, or cervix, and around the anus. And mostly around, if we talk about the cervix, it can cause cervical polyps or growth on the surface of cervix. Cervix is basically, if we talk about the uterus here, if I draw a uterus here like this, and this area junction between the uterus and the vagina is called the cervix. So this virus mainly affects the cervix. If we talk about its, infection other than the what, it causes a very slow changes in the lining of the cervix, which leads to the cancer. So HPV is also one of the dangerous viruses that can be transmitted to the uh, intimate contact. Next one is hepatitis B and C. Hepatitis B and C are viral infections that attack the liver and cause both acute and chronic diseases. They are spread through the contact with the blood and other body fluids. Either they can be transmitted through the oral fecal route, or they can transmit it to the through the blood, or they can be transmitted through the sexual contact. Hepatitis B transmission occurs with exposure to infected blood, infected semen, and other body fluids. Hepatitis can also be transmitted from the infected mother to infant at the time of the birth. So this transmission is very, very obvious. If the person is already hepatitis B positive, he should get a regular screening for that. He should get a regular treatment for that. Uh, so he must not, infect other persons through blood, through semen, or through other body fluids. Sometimes hepatitis B can also be transmitted to the saliva, because most of the body fluids of that person is infected. Hepatitis C is mostly spread to the blood-to-blood contact, such as unsafe injection practices, inadequate sterilization of medical equipment, and transfusion of unstained blood and blood products. So hepatitis C is least likely to be transmitted to the sexual contact, but still it can be transmitted to blood-to-blood contact. But hepatitis B is, can be most likely transmitted to the saliva or through intimate contact with the person who is already infected. Hepatitis B can be prevented by the vaccines for hepatitis C. There is no vaccine available. Chronic hepatitis C can be treated and cured. So there are few symptoms mentioned of hepatitis B. If I zoom this, it can cause jaundice, yellow eyes, and the yellow skin. A person can lose appetite, weakness, or fatigue. It can cause headache. It can cause hives. Uh, it can cause joint pain, pain in the right side of the abdomen because liver gets swollen, so it causes, a sensation of tenderness, and fullness in the right side of the uh, abdomen, just below the ribs. So it can cause nausea and vomiting. It can cause dark urine and pale feces. It can also cause fever. So these are the most common symptoms of hepatitis B. A person may or may not have all of them, but they mostly have this jaundice, fever, dark urine, and pale faces and fatigue. So these were symptoms of hepatitis C. Hepatitis B, hepatitis C are also similar. Mostly it can be asymptomatic because this disease is very chronic and it can take years to progress, or if left untreated, hepatitis C can lead to hepatocellular carcinoma. So this was all about the viral STDs. The very last segment of the STDs are parasitic STDs. After the parasitic STDs, we will move to the treatment, prevention, and other awareness options for the STDs. Parasitic STDs are infection caused by parasite organisms that live on or inside the organism, the host, and can cause the disease. The primary types of parasitic STDs include trichomoniasis, pubic lice, also known as crabs, and scabies. These three diseases that can be easily transmitted from sexual contact. These STDs different from the bacterial and viral STDs in that way they are caused by parasitic organisms and typically involve visible infestations. The, the these parasitic STDs or sexual transmitted infections can be seen with naked eye. The pubic lice can be seen with easily with the eye. Naked eye scabies is an infection uh, that is that causes itching of all over the body, and it is also caused by a parasite. It can easily be transmitted from one person to another person if he gets in sexual contact. So we will move the one by one details of these parasitic STDs. Number one is trichomoniasis. It is also known as trick. It's very commonly sexually transmitted infestation.
I don't
Infection.
know, Dr. Jamil, I don't know if I may interject very quickly, as you seem to be getting into a new section of your presentation, and we are about to run out of time. We have just about 5 minutes left, and
Okay.
we
I
have
will try to
questions
wind.
that the participants would certainly like to ask. Thank you.
Okay, I will wind up. Thank you. So in the infestation or this one is trichomoniasis. This is the one of the diseases that can be caused by the visible infestation or caused by parasites. And in this one, men usually do not have any symptoms. Women mostly have frothy colored vaginal discharge and may have negative outcomes in the pregnancy. Next one is pubic lice, also called tabs. They are tiny parasitic insects that inhabit hair and skin in the pubic area. They feed on human blood and lay eggs in their hair clothing. If I zoom in, these are tiny lices and these are pubic hair. As you can see, they can be visible by naked eye. So this is one of the infestations. It can be treated by using the medicated shampoos or then lice killing medications. So next one is scabies. It is a very contagious skin infestation by a tiny mite known as Sarcopsis scabiei. In this infection, this usually a rash is formed like this. There's extensive itching all over the body, and it can be spread through the very close physical contact, to the sexual contact. It can be spread by wearing clothing, towels, or bedding used by infected person. And there is a whole list of lotions available that can kill scabies mites and their eggs, which are applied from the neck and down and left on the at least 8 hours. So in this, we apply a lotion for the long hours, and we advise the person to keep a very hygienic environment to get cured from the scabies. Treatment options, basically for the bacterial STDs, we have antibiotic treatments Their treatment choice depends on the bacteria, type of bacterial infection. Viral STDs cannot be cured easily, so but we have antiviral supportive medications that can manage symptoms. Parasitic STDs are usually treatable and curable with antiparasitic medication. So preventive measures. Using condoms and other barrier methods can also prevent STDs. Vaccination, wherever possible, a healthy person he should not risk uh, for to go for the unprotected sex. Regular STD testing is very important. Open and honest communication with a partner about sexual health. If one person is already infected, he should let the partner know and he should see a healthcare provider. Safe sex with preferably not more than one partner is usually safe medically. So safe sex practices usually this kind of internal condom. It can be used. External condom is used. Dental dam can be used, and sterile gloves can be used. These all are safe practices that can prevent the sexual transmission of these bacteria, viruses, or this is a self-testing kits. They are available in the market. They are personalized. This one is for male, and for female there are also available kits in the market that person can test his blood or urine and check his status for the STD. Vaccination options, there are vaccines available for HPV. Can cure it can make the person immune against the HPV and against hepatitis B. There is also vaccination available. So the very important factor here is the communication. Open communication about STDs and sexual health is very important. Discuss STDs, testing, safe sex practices with all the sexual partners. Have open dialogues with healthcare providers about sexual health concerns and questions. So this is a very summary about the presentation of the today. Number one is the high incidence of STDs, both globally and locally, highlight the urgency of addressing these diseases. So there is a high incidence classification of STDs into bacterial, viral, and parasitic, each with its unique disease profile and treatment consideration. We already talked about it in detail. The individual examination of various STDs, detailing the causes, symptoms, complications, transmission method, and treatment. We saw them in the pretty good detail. The importance of prevention measures such as safe sex practices, regular testing, vaccination, open communication, the need for the increased awareness, education, and resource availability to manage STDs effectively. So they we can manage these diseases either by vaccination beforehand. If the person gets infected, we get him cleaned and we get him treated, so we can break this chain. So it is very important to have safe sex, to have cleaning regularly on the regular basis, and to be vaccinated and to get treated if a person gets infection. So this is the very last slide I would like to have to address the questions if you have.
Thank you very much for your presentation, Dr. Dr. Mohammad Usama Jamil. The presentation was really very data intensive. So many technical terms that we suddenly had to deal with. But we're gonna go through the questions, and the first one, we don't have time for too many questions, but we're gonna first allow Charles Niame. Charles, the first question is gonna be from you.
All right. I just asked quickly about the cover for the vaccination for hepatitis B, because when we got it, some told us for the 2 doses, it could cover for 10 years, and some said for life. So if you have any idea, Dr. Usama, I would love to know. Thank you.
Thank you.
So, Charles, I would like to tell you that there are vaccines that give us lifetime immunity, as well as there are vaccines that ensure us immunity for a few years, like 5 years or 10 years. For hepatitis B, in different countries have different regimens. Like in different countries, ensured the immunity for 10 years. So the person after 10 years have to get a booster dose to get his immunity, boosted again for next 10 years. So
Okay.
in countries, there are lifetime options available. I
All
hope.
right. Okay. Thank you.
The
Good.
second question with you, Richie Adewuzi.
Yes.
Thank you, Dr. Valsin, and thank you very much, Dr. Usama, for your presentation. Very informative. However, for a presentation of this nature and for an audience of this nature, one would have thought that would have had some data to back up some of the issues raised, especially maybe looking at, if you like, regional perspectives, so that people can have an understanding or better understanding of the profile of these issues within the areas that they are resident or they work in. When we talk about infection issues, especially when we talk about reproductive health issues, and then usually people say, well, that's not my problem. But then if we put perspectives, especially put figures to things, and put those figures in context as in environments within people find themselves, there might be a different thing, about them. That's just what my question then. That was a general overview. My question then is, is it possible to have some data attached to this presentation? Even, yes, it's over, but I also do know that the university has makes available these presentations for students to use going forward. Is it possible now to have some data attached to this presentation so that it can have some more traction? Thank you.
I think you're asking me to, about the literature which I have used, like for the stats. Am I right?
Excuse me?
Are you asking about the literature or the stats that I used in this presentation?
Not literature, not literature. We talk about infection. We're looking at data, maybe if you like region. If you talk about STDs, the specific STDs, what's infection rate in specific environments? If you talk about HIV, yes, HIV is no longer in the front burner of the public health issues for so many years now, yet it's there. It's there.
If I may, real quick, Richie, jump in temporarily. I recall at the very beginning of Dr. Jamil's presentation, there were some very pertinent statistics from the World Health Organization about the prevalence of either STD or any other sexually transmitted disease. We had some statistics. As a matter of fact, the presentation is going to be available to you, and you can eventually review some of those data presented at the very beginning of Dr. Jamil's presentation. But maybe Dr. Jamil has a different stand on this question raised by Richie. So go ahead, Dr. Jamil, if you want to add a little bit to what I just said.
There is a whole, a list of researches available, that suppose this incidence of the disease like STDs and other infections. So this disease, this kind of disease are, are highly variable in different countries, depending on the different social circumstances, depend on the financial circumstances, development in the country, development in the health sector. So there are different stats in the different countries. For example, in my country, in Pakistan, uh, the antiretroviral therapy for the HIV is still very expensive. A lot of people are unable to afford it. So there are a lot of researches available in the US and the UK, which is being used worldwide, like many countries that are in the developing phase that are using those stats. Some of them are using their own. So yeah, the research conducted by, for example, UK is most likely to be implemented on the UK because the disease density in a population is highly, specific in that population, that depends on the very, a lot of circumstances, like social circumstances, their living habits, their sexual practices, and many other things. This is a very, vast topic to comment on, but time is really short here. I already skipped many parts of my presentation, which I took hours to make. I thought I had 2 hours, but the time was really short for this presentation. I hope I would get more time in the future, so I would like to talk about more these kind of topics, and I would like to share more about in the future.
Thank you very much, Dr. Jamil. Going now to a question with Gertrude Gondry. Gertrude. Gertrude Chifambe, your question, please. The floor is on your end. Are you ready for us, Gertrude? If not, we're gonna go to Victor Baye. And that might be the last question.
Okay.
Let's try. The sound is not very clear, but let's try.
Yes, that's why to this end, where I am, I was not getting anything from the presentation. That's why I'm asking if I can share the slides, please, in the chats. That would be helpful.
Okay.
Hello?
Is that something that you can do on your end, Dr. Jamil? If not, the presentation will be shared with all the participants later on today. But Dr. Jamil, do you have a way of putting a link to your presentation on the chat line at this time?
I do not have a link on the hand, but I can share to the coordinators.
Okay.
To Clara, maybe.
Okay. I want to apologize as well, ladies and gentlemen, for the sound not being not very, very clear on the end of the presenter. But of course, like he just pointed out, the whole presentation will be made available to each and every one of you at some point in time. Let's try now to address the last question that's going to be with Victor Bayai. Victor?
Yeah, Victor Baya, it is from the UK here, though I'm originally a Nigerian. Yeah, but my question is, after such a beautiful presentation by the presenter, in fact, it's a timely one, and also very, very necessary now. My only question is, I've heard that there are scientific treatment or cure to HIV, or as it may be, AIDS as a full-blown. Yeah, do you have any remedies or any of such cures, if you can share with us? Thank you very much.
At this point, I can share that there are a regimen known as antiretroviral therapy that includes a list of medications that is available against the HIV that do not completely eradicate the disease from the body, but it causes the shreds virus from the body to a very low level that it gets almost not detectable or non-transmissible to the partners, or it cannot be transmitted from the mother to the fetus during pregnancy. So the treatment options that are available that does not that can cure the disease to a very maximum extent that the virus gets to the very lowest level in the person's body, and lowest enough to not get transmissible from one person to another, but it is not cannot be completely eradicated yet. So there is not a regimen that can completely eradicate from the body, but there are medications if a person takes on regular basis. this virus gets in very gets controlled in the person, so it does not cause damage that it caused without the medication. I hope you get my point.
Thank you very much, Dr. Jamil. Ladies and gentlemen, that was the last comment by the outstanding presenter, Dr. Muhammad Usama Jamil, on the topic of sexually transmitted disease. I certainly appreciate the time that each and every one of you has taken to be in attendance to this session, reminding you as well that the whole recording will be made available to you. I'm not from the technology department. I cannot tell you very exactly, very accurately when that's going to be taken care of. But yes, you will have a copy of the presentation so that you can, at your leisure time, review all the information and data presented during this live session. It is the standpoint of everybody among our attendees that the level of presentation was very high. And I want to thank you very much, Dr. Jamil, and I hope you will certainly respond should an invitation be sent to you at some point in time in the near future. I want to thank all of you, ladies and gentlemen, for your attendance again, and I do hope you have a very blessed Tuesday. It's been a real pleasure, and I love you all. Thank you very much, Dr. Jamil. Thank you,
Thank you.
everybody.
Bye-bye.
Be blessed.
Thank you, Dr. Wasim.